here's the thing. We want to stress there's nothing wrong with wanting to lose weight. We just want to make sure it's coming from a place of acceptance, not judgment, and you have all the information that you need. So please welcome Dr. Antonia, Sappong, and Dr. Sandy Van. We're going to talk about it. We're going to talk about all of it. Thank you so much for joining me. You know, it was a long intro because a lot of what we do here has shifted, you know, the way we deal with weight loss. And we feel really strongly that there is a ton of info out there and we need to suss through it for our viewers, okay? So the desire for these drugs, pretty big right now. There's so much confusion as well. We're gonna start with this new breed of weight loss drug like Ozempic, Wegovy. Can you talk to us, Dr. Tony, about what these drugs actually are?
Yeah. So initially, these were drugs that were designed for diabetes management. And what we noticed is that people were losing weight when they were taking them. And so it became a question of, can we use them specifically for obesity management? And it turns out that we can. And so what we typically see is that people lose between 10 to 20% of their weight when they're on these medications.
Right.
And there's newer emerging evidence that they're actually cardioprotective, meaning they reduce the risks of strokes and heart attacks as well. So we'll have to see where the evidence goes, but there's lots of new stuff coming up every day.
Okay, and Dr. Van, how do they actually work in our bodies? What are they doing?
So in the spirit of this conversation, based on GLP-1s and the injectables, GLP-1 is glucagon-like peptide 1 receptor agonist. And it's a mouthful, but it is essentially a gut hormone. So we have a number of hormones that are produced in our gut when we eat. And these are hormones that are meant to signal satiety or fullness. They're meant to tell you to stop eating. And the idea with treating obesity with weight loss medication is effective medications will actually address the appetite signaling in the brain. And so what we're doing is injecting GLP-1, supplementing a hormone that's promoting satiety, but it also has the added benefit of going to the pancreas, regulating blood sugar, and slowing down the gut motility. And it mediates weight loss through a calorie deficit. A lot of people will wonder, well, if it's a calorie deficit, then why can't I just eat less? And the reality is that eating less is hard because there's a lot of things that affect our appetite. And these medications are really clinically beneficial for keeping weight off. So up to 10 to 20% is weight loss is what you can see from some of these medications.
So essentially what they're doing is making you have less appetite.
They are regulating appetite.
Regulating your appetite.
Yes. The thing about obesity is that it's characterized by appetite dysregulation as well, that when you're losing weight, there's often this cascade of events that occurs that makes you hungrier, your metabolism slows down, and so there's this biological imperative to regain weight that is oftentimes what undermines weight loss progress. So these medications help buffer against that.
Okay, so it's like the people you know in your life that are like, I forgot to eat lunch.
Right. Yes, they're less food preoccupied.
What does that feel like? So it makes it like less, you're not preoccupied with food. So I want to talk about side effects because these are huge, and this is what I keep hearing about. I keep hearing about projectile vomit. I hear about diarrhea. I hear about all the side effects. Can you talk to us about the side effects?
Yeah, so I think first things first, for the majority of people, they're actually going to be mild to moderate.
Okay.
And they follow sort of logically from how the drugs work. So because the drugs are really working to slow emptying of the stomach, they work to slow the gut. What we sometimes are seeing is that people experience a lot of nausea. Nausea, a little bit of vomiting. This is somewhere between 10 to 40%, particularly when you first start the medications. Often, as your body adjusts, those side effects reduce. Other common things, constipation, a little bit of stomach pain.
Okay.
There are much less common side effects that affect a minority of patients, like less than 1%. These are things like pancreatitis, so inflammation of the pancreas, gallbladder disease, bowel obstruction, and gastroparesis, which literally is paralysis of the stomach. It just stops functioning as it should. But again, very uncommon.
Can we talk a little bit about eligibility? Who is eligible to access these drugs?
Yeah, so these medications, the eligibility criteria is based on BMI. And we all know BMI is not the be-all, end-all. It's not a great measurement of health, certainly, but we need to start somewhere with medications. It's going to be a conversation with you and your doctor about more than just BMI. But that said, in terms of the actual eligibility criteria, if your BMI is greater than 30, you're eligible, or if it's greater than 27 and you have one obesity-related health condition, so high blood pressure, high cholesterol, diabetes, or fatty liver disease, then you're also eligible to take the medications.
I want to talk about access now quickly, because how much do these drugs cost? Like, everyone's saying this is rich people stuff. Is it rich people stuff in Canada? Like, how much do they cost?
Yeah, I would say that it kind of is.
Yeah.
The cost of the medications on average, depending on the dose, it's based on the dose, but somewhere between $250 to $500 a month, in that range.
$250 to $500 a month.
Which is a lot of money for a lot of people.
Yeah.
And so when I think about access, I really do think like these medications, there's health equity considerations that we should be thinking about because these aren't going to be affordable for everyone. People are going to be, sacrificing other things to try and afford these medications because weight loss is something that so many of us want so badly. So, is it impacting their ability to eat healthy food or to, find joy or, heat their houses, whatever it might be. I do worry about that. And I think it's something we really need to consider when we're thinking about these medications and when we're talking about access and, regulating how much they cost as a society.
And can I add that cost is oftentimes a barrier for my patients, but I often say some is better than none. So because the cost is dose dependent, sometimes patients can stay or people can stay on a lower dose of the treatment in order to make it manageable in terms of cost. So we're not quite there yet in terms of full coverage, but there are new medications coming out where hopefully insurance plans are going to be providing coverage. But for the time being, I'm saying some is better than none. So even if you're not on the full dose or therapeutic dose, it might be beneficial.
A small dose can do something.
Yes.
Well, here's what everyone wants to know, though. Do you gain the weight back? And, do you have to take these drugs for life?
Right. And this is the most common question I get when I'm starting people on treatment. And I always invite people to consider the fact that obesity is designated as a chronic medical condition or a chronic medical disease. And chronic meaning that it's long-standing, progressive meaning that it gets worse with time. And so we kind of treat it like it's diabetes or hypertension. When you are diagnosed with those things, people start on treatment. And so the same goes with obesity. When you start somebody on a weight loss medication, oftentimes what you're doing is treating the etiology, you're treating the appetite. But when you withdraw treatment, we see weight regain, so weight relapses as a byproduct of your brain suddenly seeing, oh, you're off treatment, but your weight's down. Okay, we're going to increase your hunger, we're going to decrease, your fullness, and we're going to try to close that energy gap. So your brain is doing something that it thinks is good for it, because we're hardwired as hunter-gatherers, but it's maladaptive in this setting.
So you will gain the weight back if you get off the drug?
You're at risk of weight regain if you discontinue.
Yeah. Okay.
Yeah.
So Dr. Tony, you mentioned something we want to talk about more in the next segment we're going to have. We're going to delve deeper into these drugs and talk about the idea of, is this empowering for women? Is this undoing strides in body positivity? Can these things all coexist harmoniously? Let's